I'm really happy to be here today to share with you a little bit of the journey that we've been on at REI to move forward in our strategy around improving the health of our population. And hopefully most of you in this room are familiar with REI, but I just wanted to give you a little bit of the REI profile. We are a multi-channel retailer based here in the Pacific Northwest. We actually started in Seattle. For a one-time $20 membership fee, you are a member for life, and we return a portion of our profits to our members in the form of an annual dividend. By the end of this year, we will have over 115 stores across the country. At this point in time, we are over 10,000 employees across the country, a number of them based here in the Pacific Northwest, and we're very proud of the fact that for the last 14 years in a row, we have been named one of the best companies to work for by Fortune magazine, and prior to that, we were featured in a book. So that's something that is very much on the radar screen for us, and we take very seriously and pay a lot of attention to employee engagement. A little bit more, not surprisingly, a lot of our employees are young, healthy, active. Our average age is 37 for our benefit-eligible population. We have a huge part-time workforce, however, and as you can imagine, many of those tend to be younger. Average age 26, that makes up 2/3 of our workforce. But what might be surprising is we have a lot of older workers come and work to REI, sometimes while they are still working in their primary profession or career. And many of our part-time employees, including our older workers, have atypical jobs. I mean, we have a lot of highly professional accountants, attorneys, and engineers, so really a highly educated workforce. And then 54% of our workforce is male. But we are attracting a larger segment with growing families. So when I started at REI, so it's now almost exactly 3 years ago, I was a bit surprised by the fact that we did not, in spite of the business that we're in, an outdoor recreation retailer, did not have an articulated strategy around improving the health of our population and, more importantly, addressing productivity. So what we did, and I'm just going to quickly run through some of these, is put forth a strategy around health and absence management. And as is typical when you embark on strategic planning, we did a situational analysis, and these were some of the learnings that we identified. One that worked in our favor was that well-being and wellness and health and activity were core values at REI. It's still very much a cultural norm for our employees to be out during their lunch hours, running, biking, playing volleyball, frisbee. We offer very generous benefits, both on the health as well as the time off side. So we really encourage people to take time to enjoy the outdoors. As I mentioned earlier, employee engagement is important and a really highly valued component of our culture at REI. What was not working in our favor so much was the fact that we do attract a younger demographic, particularly in our retail segment. So those employees this may be their first job out of college. They're not particularly savvy when it comes to healthcare or even benefits. This may be, in fact, their first exposure to benefits. We talk a lot about our employees being healthy and active. We didn't have any data to substantiate that or to identify where we had opportunities. We didn't have a formal absence management program in place. We didn't have ergonomics or a return to work program. And we had very inconsistent management as it related to our leave of absence or disability programs. So we saw some both opportunities and threats in that. One was that we had an opportunity to focus more on the consumer and engaging our employees in the same way that we engage our customers to be savvy shoppers, really helping our employees understand what their options are, make informed choices, embark on some behavior change programs. And then what we were starting to see as really red flags for us was the fact that we were starting to see a leveling off and even a dip in the compliance with preventive care, recommended preventive care services, and some of those early indicators of chronic disease. So while we'd always enjoyed this very healthy workforce, we were seeing that if we didn't do something, that was at risk. So we developed a fairly broad benefit strategy, and you can see it here. Some of the tenets of that strategy were really around fostering and enhancing this culture of health, looking at absence management as a way of having our employees not only present but productive and engaged. We really knew that we needed to have flexibility and provide an array of options and programs given the diversity of our workforce. Something that might not be something you typically see as part of a benefit strategy is this idea of stewardship of resources. And one of the things that we wanted to do was leverage familiarity. So at REI, we have a high level of awareness and focus on stewardship, particularly of natural resources and the environment. We wanted to extend that to other areas, such as precious healthcare resources and programs that we have in place available to them. So that was a very intentional part of our strategy. And then you see there empowered consumers and shared responsibility. A couple of years ago, we really started to drive home the notion that you as the employee and your family have a stake in this as well. And we have a responsibility from an employer perspective to make those programs and resources available to you, but you need to take ownership and have accountability for making informed choices and decisions. So I'm going to run through the strategy fairly quickly because I really want to get to some of the tactics that we used. And this was our real one area of our strategy. It was very much a multifaceted approach, but the consumer engagement piece was core for us. So we knew we had plan designs that didn't incent or even motivate people to really understand the cost of care. We just this year introduced a consumer-directed health plan option for our employees, made it very attractive from a pricing standpoint and contribution standpoint. We knew we had employees who were, at that point in time when we developed the strategy, playing a pretty passive role as it relates to their health care. We really wanted to activate them, engage them, and being a partner with providers. So I'll talk a little bit more about that as we later in my presentation. And then our contribution strategies. With many of our benefit programs, we are very generous. We really, not that we wanted to put it all on the backs of our employees, but we wanted to ensure that they understood that they had a stake, that they had skin in the game. From an employee wellness program, we did not have a formal program in place, so that was one of the first things that we paid attention to and developed and rolled out actually last year with incentives, and that gave us some workforce metrics to know where we wanted to pay attention to. This was another area that we included in our strategy around organizational support, both from a leadership standpoint, but also from an environmental and cultural standpoint. And the bottom area there, education and communication, that's where an area where I would say we invested a lot of time and energy in formulating our plan and have really focused a lot on the educational and consumer engagement piece. So an example of that is we migrated a couple of years ago from a lot of hard copy material to a website now for your benefit that houses all of our benefit programs and information. And the way that we bucketed it was to encompass all of our benefit programs, not just our health and welfare programs. So you can't see it very well on this slide, but it's health and well-being, financial peace of mind, and day-to-day living. And so under each of those categories is all of the different programs that we have available. This year, when we introduced the CDHP, we went through an exercise of branding our plans. They're administered by Aetna, but our employees didn't really understand that we're self-insured, we're the insurance company here. And so we did some things to, we wanted to make sure that they understood that they had meaningful choice, and we differentiated each of those plan options. We created a module, a flash module, that they could view even on their smartphones with profiles of employees and depicting each of the plan attributes. I'm sorry, this is not updated. The HealthQuest program that we introduced last year was branded as well, and this is very typical for REI programs. Is we want to make sure that it resonates with our employees, so we branded it HealthQuest as their journey to well-being. It was designed as very much like a frequent flyer program with key milestones, and it's a points-based system. At the first milestone, which is the trailhead, they are eligible to receive a premium contribution credit off of their annual contributions. And then throughout the year, there are challenges and activities that they're encouraged to engage in for additional points to get some additional rewards. Again, completing the well-being assessment, contacting a coach to develop a personal health map, and then taking part in challenges as well as stewardship activities. So I would say one of the unique aspects of our program is the scope and comprehensiveness of the areas of well-being that it encompasses, including environmental well-being. So again, that stewardship around natural resources and recycling and alternative commuting, those kinds of practices, as well as things like financial well-being. This fiscal fitness challenge that we did mid-year was, to date, still one of the most popular challenges that we've held. We knew that our employees are not at a computer, so we needed to figure out ways to make the program accessible. So while it's a branded program, employees have access to it via their smartphone or mobile device. And so we pushed out information about mid-year again to encourage people to set it up on their smartphone so they could track their activity via their mobile device. We did a refresh of some of the components of the site to make it more apparent where they are in terms of reaching the next milestone, and also having it more visible what their next step is. So again, pushing out information or serving up information that is very personalized, tailored, and relevant to that individual based on their well-being assessment results. So it may say, here, you're currently a smoker, here's information about our Quit for Life program, or if their BMI is up, here's information about mind and body. And then they also have the opportunity to do peer-to-peer challenges as well as some of the corporate challenges that we do. You know, I mentioned earlier that our employees, many of our employees, don't have a lot of experience with the healthcare delivery system. And so the other resource that we introduced last year was this idea of a health concierge. This is delivered through our Aetna program under a concierge type of model. But this is really their one-stop shop. This is who they go through when they're not even sure what the question is. If they have a question about a medical condition or a claims issue, or they need to initiate a leave of absence, or they want to know, how to find a child care provider. All of our resources are accessible via the REI Health Guide. So again, it's that telephonic one-stop shop, just as our website, the For Your Benefit website, is a web one-stop shop. So how do we know that we've had any success? We have a fairly broad scorecard when we look at things. So it's really from the employee experience to productivity. Have we made a move the needle in terms of absence management? Has there been an improvement in health? And then ultimately, we want to make sure that we're delivering on the reducing our medical trend. So I'm going to share just a couple of examples. And those of you who have been in the field know that, and one of the speakers earlier alluded to it, that there's a natural progression of risk. If you can even mitigate the progression of that risk, then you're doing well. So this is year-over-year change, shift in our risk profile from the low 0 to 1 risk up to the high risk 5 or more risk factors. And we just completed year 2 of our wellness program. So you can see we've reduced the proportion segment of our population at high risk, and this represents only those who were in the program the full 2 years. So it's comparing their first year results to their second year results. And then we increase the proportion in the low risk category. We also, in our well-being assessment, look at key dimensions around productivity as well as well-being. And so all of those scores were below or better than the average. Same for well-being. And then our healthcare expense control has also been improved. This shows our data compared to large groups as well as Fortune 500, and then our peer group, the retail trade industries. So it's great if you can even flatten your trend. We actually saw a dip in our year-over-year expense. And so the return on investment for us is really across all of those dimensions. Enhancing well-being and productivity is the ultimate goal, but it also provides a benefit to our retail leadership. So if they know who's going to be coming back from a leave, if we can shorten the duration of disability and have people present and productive, that really contributes to our organizational success. But the employee engagement and commitment is clearly a metric that we continue to watch year over year, and that has not changed at all. In fact, year over year, we continue to see high marks when we bench not only against our peer group, the retail industry, but top performing companies. So we're very proud of that. And that's it. Thank you.